Hello everyone, my name is Nurchinur. I'm product manager at iCare for iCare Home, and here today we would like to talk about iCare Home 2 and how it can help with your treatment decision. We had iCare Home in the market for a while now. Previously we had iCare Home and iCare 1 in the market. Currently we have iCare Home 2. The usability on the market has been quite impressive so far, so we have here today Adrian from Mainline. He can demonstrate us how easy to take measurements with iCare Home 2. So basically user has to just start the tonometer and then load probe. There are the forehead and cheek support for finding the correct distance from the center of the cornea. And the tonometer supports the user on taking the measurement. There are light guides in the tonometer. It helps user to take the correct position. It will also display error messages if the position is wrong. And once the successful measurement is completed, the measurement result is also displayed on the screen. It's also easy to dispose of the probe after the use. Okay, so we have seen how easy to use iCare Home 2. Let's have a look at a patient case from a private clinic in Ireland. So this patient had a POAG for the last 12 years, and previously the patient has been on a fixed combination therapy with latanoprost and timolol, and the patient had ceased the treatment due to side effects. During the initial visit to this private clinic in Ireland, the patient had IOP levels on the right eye 24 and on the left eye 34 millimeters of mercury. The visual field also exhibited progression in the last 3 years. After this initial visit, the treatment was adjusted and alternate topical medication was prescribed. However, the progression was still continuing despite the compliance of the patient to the drug. Following that up, the doctor decided to prescribe iCare Home for following up and monitoring on the diurnal progression of this patient. And 24-hour monitoring had revealed IOP levels predominantly above the normal levels. And the target IOP for this patient was 14 millimeters of mercury. However, as you can see here, there are 24 and more than 24, around 25, 26 IOP peaks, millimeters mercury of IOP peaks were observed during this monitoring period. And after this monitoring period, the doctor has decided to continue with the surgical intervention. She performed trabeculectomy on both eyes, and post-surgical measurements have shown 7 to 12 millimeters of mercury IOP levels on both eyes. The doctor has continued to prescribe to follow up on the progression, whether there was a progression or not, and 2-year follow-up on this patient have shown no progression. And basically what we would like to say here is that in diurnal monitoring, iCare Home 2 can help you support your decision making and also supporting on your surgical intervention pre and post operatively. Thank you very much.